Hello, I'm Ameisha Tutwiler. I'm a second-year medical student at the University of Toledo College of Medicine and Life Sciences, and I'll be presenting to you today, introducing racially based traumatic stress and trauma-informed care in an anti-racist curriculum. Here are my disclosures. Racially based traumatic stress refers to the mental and emotional injury caused by encounters with racial bias and ethnic discrimination, racism, and hate crimes. Any individual that has experienced emotional pain, sudden and uncontrollable racist encounter is at risk for suffering race based traumatic stress injuries. In the United States, Black and Indigenous people of color are most vulnerable due to living under a system of white supremacy. And the stress can also be recognized as generational trauma spanning back to early slavery. Currently, this framework is not acknowledged by the APA or the DSM-5, and it in trauma-informed care is not traditionally emphasized in the medical curriculum. Please note that RBST is not PTSD because the onset of PTSD is usually isolated to one event or period of time, whereas the Black experience or the non-white experience is lifelong. The students at the University of Toledo College of Medicine and Life Sciences created a course called Medical Racism and Systemic Health Inequities. One of the mandatory lectures was centered around the racially based traumatic stress and introductions of trauma informed care. Students learned how to identify RBST, factor negative and positive coping mechanisms into their patient interviews and comprehensive treatment plan, and avoid being contributors to RBST in a medical setting. Students learned the basic principles of RBST, such as its causes, which span from microaggressions or microviolence experienced on a day-to-day basis to overt experiences of violence, for example, police brutality. These principles were taught by a community psychiatrist, and students also learned the sequence of trauma responses in a medical setting and scenarios which can be upsetting for their patients so they can learn important validating statements. Here's an actual excerpt from our slides. We opened the lecture with a 10-minute breakout small group discussion where students identified their own difficulties and triumphs with identifying triggers of their trauma. And then we had a large group discussion as well about how they've seen trauma manifest itself in loved ones. These activities really personalize the issue for increased awareness and empathy for situations which can oftentimes feel pretty distant. Here are two cases we discussed. I encourage you to pause the video and read these cases through so you can follow along. For the first case objective, we wanted to understand how the body and brain respond to stress and how it plays a role in our daily interactions with patients and our peers. So we sequenced the trauma response with our patient, Glenda. For our second case, we had a transgender child who we looked at how the child might be labeled versus what might actually be the cause of their behaviors in order to kind of rid away with stereotyping of behaviors. We wanted to learn to recognize the possible effects of trauma on patient and patient peer behavior. So here's case one. The students were supposed to chronologically order the stress response, and it helped them to better identify the stages and progression of stress responses so they can efficiently work to de-escalate it and turn around their patient interactions early on. And then here was the activity for case two, where two parents of a transgender patient, one of whom very clearly did not support their child's identity, came in to seek help for their child's misbehavior. So students were challenged to look at certain labels with their trauma glasses on and see why someone might be behaving a certain way and might be labeled a certain way instead of quickly writing them off as oppositional or non-compliant, which is a common term. As a result, students were able to define and challenge their perception of trauma and how they learned about in the past. They learned how systemic racism causes ongoing trauma, and overall, they learned how their communication could actually influence medical distrust and longstanding trauma in marginalized communities. So we wanted to learn how to identify those responses and de-escalate it and create a safe space for our patients. Ultimately, trauma-informed care and awareness of racially based traumatic stress can improve the physician-patient relationship to hopefully regain trust in a community that has very valid reasons to feel distrust. And ultimately, this will reduce the incidence of chronic disease in those communities. So we hope this topic can be discussed more now in medical schools, and students need to learn about these topics early on in their preclinical career so that they can have longitudinal learning. Here are my sources. And thank you so much. Please feel free to reach out anytime if you want to discuss more about this lecture.